Hi, my name is Adrianna Williams. I'm a rising senior at Duke University studying neuroscience, and today I'm going to be talking about COVID-19 dependent communication growth. The first reported outbreak of the novel coronavirus was on December 31st, 2019 in Wuhan province in China. It was originally identified as a group of cases of, quote, pneumonia of unknown etiology. Since December, COVID-19 has infected 11.5 million people and killed over 500,000 globally. Dissemination of accurate information as quickly as possible during a global pandemic is essential. Doing so can significantly reduce widespread feelings of anxiety, provide healthcare professionals with guidelines to ensure public health safety, and allow researchers and modelers to have a better understanding of both infection pathways and potential interventions. Rapid release of this information can also better inform public policy. For example, the CDC and World Health Organization's guidelines have motivated several states to institute executive orders for things such as wearing face coverings and social distancing to, as we say now, flatten the curve. With the Duke-Margolis Center for Health Policy established in 2016, COVID-19 is one of the first pandemics the center has responded to. Some of our goals during this time have been to respond comprehensively to the COVID-19 pandemic, help reopen the nation successfully, and create a more secure healthcare system. To disseminate our research and information that can help the country with these goals, we've developed a communication strategy to rapidly and widely disseminate this information. With this in mind, my question is, how is our communication affected by the COVID-19 outbreak? To determine this, I've conducted analyses of 3 mediums we use to disseminate our information and our research: our website, news coverage, and Twitter. Specifically, I did statistical analysis of multiple website metrics along with multiple Twitter metrics. I then conducted a qualitative analysis of news coverage by coding local, regional, national, and international media coverage featuring Margolis faculty and leadership by a variety of both COVID-19 and other health policy topics. All data was grouped into 2 main categories: pre-COVID-19 outbreak and post-COVID-19 outbreak. For the purposes of this study, I am referencing December 31st, 2019 as the beginning point of this outbreak. Overall, we saw statistically significant increases in communication growth across all mediums since the beginning of the COVID-19 outbreak. There were specifically significant increases in the percentage of new website sessions across country and age, and we also saw a general trend of lower number of users between the ages of 18 and 35 viewing our COVID-19 publications than individuals who were 36 years of age and older. On Twitter, we also saw a greater number of tweets from our account since the COVID-19 outbreak, and have also seen a significant increase in tweet impressions. Finally, there was a large increase in media coverage since the COVID-19 outbreak. Of COVID-19 specific topics discussed, we are talking the most about COVID testing, social distancing, and contact tracing. There are also a set of topics, interestingly enough, we are continuing to include in conversations even after the beginning of the COVID-19 outbreak. Of these, we are continuing to discuss payment and delivery reform, health insurance, and Medicaid/Medicare the most in conjunction with or alongside COVID-19. All of this data shows a few things. First, it shows that we are doing a great job of increasing our communication and press since the COVID-19 outbreak, and we've been able to keep many of our portfolio topics in conversation, while also shifting much of our focus in interviews or news articles to COVID-19. However, the Margolis Center should explore new strategies to reach 18 to 34-year-olds more effectively, given that they're a group with a high infection rate at this time. I want to thank you all for taking the time to look at my poster and look at my research, and I want to give a special thank you to my project mentors, Patricia Green and Sarah Dunn Phillips. Thank you.